Familial hypertriglyceridemia is an autosomal dominant disorder characterized by elevated VLDL and triglyceride levels. In this image, we'll be joining a soon-to-be bride as she tastes olive oils for her upcoming wedding. Buckle up, it's time to hit Napa Valley. First, take a look at all these olive oil bottles. At Pixarize, we use glass bottles of fatty oil to help symbolize triglycerides, better known as triglycerides. Get it? In fact, this is a family-run orchard, so you might even say that these are familial triglycerides. This should help anchor you to our image on familial hypertriglyceridemia. Next, shift your attention to the big cottage doors on the left here. Don't cottages always have big doors? Or am I thinking of barns? Either way, this door is here to help you remember that familial hypertriglyceridemia is also known as type 4 hyperlipoproteinemia. Get it? A door for type 4. The door has been left open because they're busy transporting bottles of olive oil in and out of the cottage. See the giant delivery truck outside? At Pixarize, we use large dominant automobiles like tanks and trucks to symbolize autosomal dominant inheritance. And the presence of this large dominant auto, that is, the delivery truck, means that familial hypertriglyceridemia is inherited in an autosomal dominant manner. In fact, familial hypertriglyceridemia is actually fairly common. This is at least partially due to its autosomal dominant inheritance pattern. Next, shift your attention to the bride in the foreground of the image. What a lovely wedding veil. Moreover, this wedding veil should help you remember VLDL. It's the VLDL veil. Familial hypertriglyceridemia is defined by an isolated elevation of VLDL. This should make sense because VLDL carries endogenous triglycerides. If VLDL is elevated, triglycerides must be elevated. Hence, hypertriglyceridemia. This elevation in VLDL can be due to a number of possible causes. For example, hepatic overproduction of VLDL decreases VLDL clearance, or a heterozygous lipoprotein lipase inactivating mutation. For the cause, recall that another disease, familial hyperchylomicronemia, can be caused by a homozygous LPL inactivating mutation. I therefore like to think of familial hypertriglyceridemia as a more mild form of familial hyperchylomicronemia. Next, shift your attention to the fiery pan at the front of the image. It looks like the orchardist was trying to show off his oil's high smoke point in an attempt to make the sale. But unfortunately for him, the whole pan is now on fire. Let this inflamed pan help you remember pancreatitis, a key clinical finding in patients with familial hypertriglyceridemia. This finding should come as no surprise since high triglyceride levels can cause pancreatitis. I mean, come on, hypertriglyceridemia is right there in the disease's name. Let's move on. Finally, focus your attention on the peeling walls behind our farmer. Yeah, those walls are exposing some of the cottage's insulation. This exposed insulation is here to symbolize insulin resistance, which often accompanies familial hypertriglyceridemia. Okay, those smoke fumes are really suffocating. Let's do a quick recap before the insulation catches on fire too. Familial hypertriglyceridemia, also known as type 4 hyperlipoproteinemia, is an autosomal dominant disorder that is defined by an isolated elevation of VLDL. This may have a number of possible causes, such as a heterozygous LPL inactivating mutation, a hepatic overproduction of VLDL, or a decrease in VLDL clearance. Since VLDL carries triglycerides, hypertriglyceridemia is therefore a hallmark of the disease. High triglyceride levels are also a common cause of pancreatitis, which therefore may also be seen. Finally, the disease is often accompanied by insulin resistance. Well, that's all for this scene on familial hypertriglyceridemia. Now let's get out of here and buy our wedding's olive oil somewhere else.